Hello, my name is Chisom Nwagbo, and I'm here with my co-presenter, Ameisha Tutwiler. We are second-year medical students at the University of Toledo College of Medicine and Life Sciences. We are presenting Learning and Unlearning, designing an undergraduate medical education course focused on racism and bias. Disclosure: the authors have no conflicts of interest to disclose.
For background, the COVID-19 pandemic and uprising in the summer of 2020 rapidly pulled medical maltreatment of minorities into public focus again. The social determinants of health model attempts to address these issues, but fails to objectively scrutinize the source of these inequities, which are structural and systemic racism and bias. Furthermore, only 40%, that's less than half of medical schools, introduce racial disparities into their current curriculum at this time, according to the AAMC. Better yet, in the current medical curriculum, racism is often misrepresented as a genetic construct in a majority of clinical vignettes. Implicit bias training is increasingly being found to be ineffective, and this has created a demand for more effective strategies, including anti-racism and anti-bias education, both of which require radical self-reflection, historical and cultural exploration to both learn and unlearn in a longitudinal curriculum. So all of these factors have led to the creation of our elective, which was designed by us and approved by faculty.
Description: medical students designed a comprehensive faculty-approved preclinical elective course entitled Medical Racism and Systemic Health Inequities. It exposes medical students to the impact of racism and biases on the social determinants of health. This spurred further discourse about the marginalization experienced by the LGBTQ+ community and disability inequities, for example. The lectures were divided into 4 parts, with topics centered on the history of racism, racism in medicine, racism in me, and lastly, anti-racism, bias mitigation, and advocacy. The course was aligned with the students' curriculum and promoted longitudinal learning. Lecture structure. The lectures utilized a multidisciplinary approach to provide education. Experts from the University of Toledo and surrounding communities in the fields of medicine, history, anthropology, sociology, law, and politics served as lecturers and guest speakers to provide a real-world context. For example, students read the book, The Political Determinants of Health by Daniel Dawes. Then they attended a lecture by the author, watched a YouTube video entitled Jessica's Story, and discussed key themes. After each lecture, additional questions and multimedia educational resources were provided to the students to promote educational acquisition. Motivating action. The goal of the course is to create a generation of future physicians committed to unlearning and continued learning about anti-racism, in hopes that they will apply methods to ensure that all patients have the opportunity to receive accessible, optimal healthcare. This course helps medical students to become aware and comfortable discussing systemic health inequities. They learn that advocacy is practicable by simply including the patient perspective in their decision-making and speaking up on their behalf. Outcomes. 1 school year of the inaugural class of the Medical Racism and Systemic Health Inequities elective has been completed. One of the immediate outcomes of the elective is the increase in the students' knowledge base and the ability to distinguish between bias and racism. The students have a deeper connection to the university community, with a desire to work with the faculty engaged in the elective and participate in DEI initiatives. Lastly, student researchers are conducting an IRB-approved study on the elective's impact on the student body, consisting of a survey and pre- and post-exams. Overall, the feedback from the students and faculty were positive. The elective created a safe space for honest conversations and for learning. There are future plans to integrate portions of the elective into the mandatory medical curriculum and for further research. Thank you all for your attention. My contact information and the QR code for the Linktree with more information about the Racial Dialogue Collective is on the screen. Also, a special thank you to the faculty and staff at the University of Toledo for helping make this elective possible.